My name is Dr. Young Choi. I have a boutique refractive cataract surgery practice in Alabama. And we specialize in providing our patients with the latest technology, but technology that makes sense and provides the best outcome. What's out there in the market, and when we think about multifocal implants, we think about diffractive technology. Diffractive technology works by dividing light, and the platform is completely different. ClearView is a refractive lens. It bends light, and the way it works is inherently different. So when you look at a diffractive lens, it creates halo. It's built into the technology, Whereas a refractive implant, you don't get the haloing. So one of the biggest complaints you get with patients with a multifocal implant is you get some haloing around certain lights or with night driving. However, I feel incredibly comfortable with a ClearView that you're not going to get that. You don't have to worry about neuroadaptation. Patients are incredibly comfortable. It's a very natural vision that they have. So I think it's just a great lens. It gives the most natural range of vision that I've seen in an implant. I think patients are incredibly happy. Where the rubber meets the road is what the patients have to say. It is not uncommon for patients to be 20/20 at distance and J1 plus up close. And to have a great range of vision without the nighttime haloing, patients have been incredibly happy. And in fact, it's interesting because a lot of my staff, when they see the outcome and when they see how happy the patients are, they obviously don't have cataracts, and they're like, when I have cataracts, this is the lens that I want. I think it's relatively straightforward. I make a 2.4 millimeter temporal incision, so I do enlarge my incision at the end of the case, but the insertion of the lens, I think, would be not a problem. It would be very natural for any surgeon. And I also orient the near portion of the IOL temporally, as opposed to doing it nasally. And I have found that to work incredibly well. And in fact, that's my default. The near ad is always temporal for my patients, for both eyes. My practice, we specialize in astigmatism management and presbyopia correction. And for patients who desire a full range of vision, ClearView currently is my lens of choice. I think any surgeon who wants to expand their kind of refractive cataract surgery practice should strongly consider using this lens. It's more forgiving than the multifocal lenses that are out there. I think it's just an easy platform to start with. And the patients have been incredibly happy, and I would say don't hesitate.